Okay, so I think we can get started. Hello and welcome everyone, and thank you for joining this conversation today. Uh, Today's seminar is a part of a seminar series sponsored by the Center for Contemporary South Asia at Brown University on questions relating to caste and economics. In this series, we have invited scholars to discuss the implications of caste on the economic lives in India. We seek to understand how caste determines ownership of land and capital, assignment across occupations, outcomes in the labor market, and experiences in institutions of higher learning. Today, it is my great privilege to introduce Diane Coffey to you all. Diane is Assistant Professor in the Department of Sociology and Population Research Center at the University of Texas at Austin. She is a social demographer who studies health in India. One area of her research focuses on the intergenerational transmission of poor population health resulting from India's exceptionally poor maternal nutrition. It traces links among gender, stratification, and poor birth, childhood, and adult health outcomes. Her work on maternal health in India has been published in the Proceedings of the National Academy of Sciences, Social Science and Medicine, and the Indian Journal of Human Development. Another area of Diane's research finds consequences of poor sanitation in developing countries for early life health, including mortality, height, and anemia. She has also studied the causes of open defecation in rural India. Rural India's exceptionally high rate of open defecation has much less to do with poverty than with social forces. The renegotiation of caste and untouchability leads people to reject the inexpensive latrines that prevent disease in other developing countries. Her book on open defecation in India with Dean Spears is titled Where India Goes, Abandoned Toilets, Stunted Development, and the Costs of Caste, and won the Joseph W. Elder Prize in the Indian Social Sciences in 2017. Diane is also a visiting researcher at the Indian Statistical Institute in New Delhi. And prior to joining the University of Texas, she co-founded a research nonprofit called RICE, which aims to inform policies about child health in India. She received an MPA in Development Studies and a PhD in Public Affairs and Demography from Princeton University. Thanks, Diane, for being with us today, and the floor is all yours. Thanks.
Thank you so much, Arushi, for that really kind introduction. I'm glad to be here today to talk with you. I would have really been very excited to come to Brown in person. I'm originally from Connecticut, and so I really love that part of the world, but hopefully soon. And before I get started, I just want to take a second to thank you for being here. I think, like many of you, I'm spending a lot of time being worried and concerned about friends and colleagues in India with the pandemic there at the moment. And so, thank you for taking the time out. And I honestly wish I were going to be having a more lighthearted conversation with you today. But it turns out that the topic I'm going to be talking about is pretty heavy too. But it is important to India's economy and to human development. And so let me go ahead and jump in. I'm going to start sharing my screen. I think I may be sharing the wrong one. Let's see. Great. Can you guys see the one that is the presentation slides?
Mm-hmm. Yep.
Okay. For some reason, it was giving me, wasn't highlighting it the way it usually does. And I don't know whether this tends to be your way of going about things, but it's totally fine with me if people want to interrupt partway through and just sort of jump in. It's going to be a little hard for me to see people raising their hands, but if they do raise their hands, Arushi, I'd be very happy for you to stop me and I can take questions as we go.
Sure.
That's also fine if we don't do that. Okay, so today's presentation, I've pulled from a variety of projects that I've worked on to try to fit with this theme about caste and economy in India, although my main focus is going to be health. And here at the beginning, I'm going to be talking a little bit about how health and the economy are linked. And so that's going to be sort of how this work is going to fit in. So I've called the presentation Consequences of Caste and Untouchability for Health and Human Capital in India. And before I get into the two sort of main projects that I'm going to be talking about, I just want to give a little bit of background about child height, why we can think of it as an economic indicator, and then also about this idea of untouchability. Many people will talk about how untouchability is different than it used to be, and it is different. And we're going to be talking about some of the ways, but it persists as an important social force, and it has economic consequences, and we're going to see some of those here today. So I'm going to be giving you a little bit of background about that as well. So, one fact that you may have heard if you study modern India is that there's a large literature pointing to the fact that Indian children are shorter than children in poorer countries. And so we don't have as recent measurement as we would like of this. The last national data on the heights of children was done with the NFHS in 2015. Hopefully the more recent round will be available soon, but this is the most recent thing we have for now. And it found that on average, Indian children under 5 were 1.5 standard deviations shorter than healthy children. So the WHO establishes norms for how tall populations of children would grow under healthy circumstances. And then by age and sex, it normalizes those heights to 0. And so if the average child in India were as tall as children who meet the WHO norms, you would see these lines being up here at 0. But instead, we plotted the average height for age z-score against the child's age in months. And so we see that the average 2-year-old in 2015 in India was 1.5 standard deviations below that WHO norm. And that's a bit of an improvement from the 2005 NFHS, where the average 2-year-old was about 2 standard deviations below the WHO norms, but it's still a really large nutritional deficit. So if we look at countries like Liberia or Ethiopia, which are much poorer than India, they're going to have average height for age z-scores even being a little bit better than what we saw in the NFHS4. So this is really an important nutritional deficit, and we're going to be talking about sort of what that means here in a minute. Let me try to get rid of the pointer. Okay. So we like to think about child height as an economic indicator because there's a large literature that links the height of children to later cognitive achievement and to adult wages and also to adult health. So we can think of, if somebody's healthier, they're going to be able to work for longer, make more money. And I'm just showing you a couple of the graphs that have been important in this literature. So this was a paper by Dean Spears in Economics and Human Biology, where it's plotting the average height per age z-score of kids 8 to 11 in India, and the fraction of those kids who can read words. And so we see that there's a very steep relationship between child height and whether or not the child is able to read. And this relationship and looking at this relationship was really inspired by a literature from the United States, looking at children of the same ages that found that indeed in the US as well, taller children are more likely to read. But the slope of the relationship is much steeper in India because height there is more likely to be determined by early life health experiences that then shape the child's development rather than to be dominated by genetics, which is the case in richer countries. Although it's still the case that there are early life nutritional and health experiences that shape height in rich countries as well. And that's what generates this relationship there. So that is one reason to care about child height as an economic indicator. And then here's a paper from Tom Vogel using data from Mexico. And so these are men in Mexico, showing a pattern where taller men have higher earnings. And this is something that's repeated in literature all around the world. So we want to think of population level child height as sort of one indicator of how well the economy is likely to be doing in the future. Okay. Now let me turn to a slight review of sort of untouchability, what it is, why we care about it. So, many of you are probably familiar with this idea that scheduled caste people experience discriminatory behavior in a variety of ways, and the sorts of practices that fit with untouchability may vary from region to region. There are sort of broad laws that were passed a little bit after independence, outlawing untouchability, and yet we still find a large number of people reporting in social attitude surveys that they practice untouchability. So this was a survey that I've been involved in, the graph on the left. It's called the SARI survey, Social Attitudes Research India. We use random digit dialing to collect responses from representative samples of adults in different mobile circles. So we mix Eastern and Western UP. Those are 2 mobile circles, but we report it as UP, Mumbai, Rajasthan, and Delhi. And we see a pattern that we would expect. Urban folks are less likely to admit to practicing untouchability than rural folks, but still really, really high numbers say yes to the simple question of, do you practice untouchability? And this work here in the SARI survey was sort of inspired and got started by something that Amit Thorad and Omkar Joshi were doing in the IHDS, where they asked a very similar question. And we redid it in the SARI survey in order to be able to look at correlates that the IHDS didn't collect, and also to update the figures, which were from 2011. So these are from 2016, 2017, and we see really similar results to what they found in 2011. So untouchability is still something that is widely practiced, and probably much more so than people are easily willing to admit. For those of you who are interested in untouchability and untouchability practices, I think that survey questions really are going to just scratch the surface of understanding it, and so we should also take a look at autobiographies. These are a couple that I recommend that help us understand sort of the pervasiveness and the violence that is sort of inherent to untouchability practices. Okay, so with that background, both on child height and on untouchability, I want to just sort of give my main message up front. I'm going to be talking about 2 different empirical projects. One is sort of a traditional research paper about caste gaps in child height, and that's going to focus on how caste discrimination shapes the heights of people from oppressed castes, STs, SCs, and OBCs. And then I'm going to pivot to part 2, which is really going to be a little bit of an overview of the argument of my book with Dean Spears, making the case that caste and untouchability are forces that not only influence the heights of people from scheduled castes, but actually make everybody shorter. And so much of my work is on rural India as opposed to urban India. So it's going to be the case that sort of, unless I mention otherwise, the graphs and tables that you're going to see are going to be restricted to rural India. Does anybody want to jump in or ask a question before I sort of move on to the first empirical project?
I had a quick one about the persistence of untouchability over time. I was wondering if that's kind of robust to family fixed effects or something like that, because I'm wondering how many young people admit to practicing untouchability if the older people in their families admit to it too.
Yeah, that is a great question. And it's one that we don't have the data for because we only interviewed 1 person in every household. And so this would be, what this finds is that 20-year-olds are as likely as 60-year-olds to say that they practice untouchability, but we couldn't say like, okay, if you have a 60-year-old who practices it, are you more likely than if your family doesn't have an older person who practices it? But I think like that would be a great next step in survey data on untouchability to try to see who in the household reports it and whether one person's response is, influencing others.
Got it. Thank you.
No problem. And these data are actually free and publicly available on the Rice website, which we just fixed. So please take a look if you're interested in social attitudes data from India. Okay, so if you guys want to know more about, I'm going to do sort of a shorter overview of this project on caste gaps in child height, but it's actually from a paper that came out recently in demography with Ashwini Deshpande, Jeff Hammer, and Dean Spears, and so you can get the full details, especially of the methods in the journal. Okay, so I wanted to start by just sort of putting up a figure that isn't in the paper, but came in a follow-on paper on EPW. So the data that we're going to use for the analysis are going to actually be from the NFHS 3, because it's a little bit of an old project. We reran the same analyses on NFHS 4, and it told basically the same story. But we found that in 2005, the average general caste child was about 1.6 standard deviations below the norm, the WHO norm, and that there was a gap of about 0.45 standard deviations between SC and ST kids and general caste kids, and that the gap for OBCs was a little bit smaller, about 0.3 of a standard deviation. And what was sort of interesting about what we saw in NFHS 4 in the 2015 round is that kind of everybody improved by about 0.4 of a standard deviation, but the gaps remained the same. So SC kids in 2015 were about what general caste kids were in 2005. And so another way of putting this, I've sort of put it on the next slide, is that SC kids' heights were about a decade behind general caste kids' heights. And to give you a little bit of like an interpretation of what does that mean for the height of a kid, so we could say that the average 5-year-old SC boy is about 2 centimeters shorter than the average general caste boy. And so this is going to be something that then translates later in life into some of the other consequences that we talked about earlier. So it's a large and important difference. So what we did in the paper was to try to answer these 3 questions. What explains height gaps between higher caste kids and children from these 3 disadvantaged groups? And we look in particular at neighborhood composition. So we're going to be seeing whether that predicts the heights of lower caste kids, conditional on other factors. And we're going to sort of raise a question that is commonly asked in the US literature on disparities, which is, what role is segregation playing here? Is the fact that a neighborhood is segregated by caste a good thing, a bad thing for SC kids? And we're going to sort of find something that's a little bit different than the rich country literature, where segregation is almost always seen as a bad thing. We actually see that SC kids are advantaged relative. SC kids who live in segregated neighborhoods are advantaged relative to SC kids who live in mixed neighborhoods, and we'll talk a little bit about that. So like I mentioned, the data that we're going to be using is from the NFHS 5. We're looking at children under the age of 5, rural children. Our dependent variable is the child's height for HC score, like I've been telling you about. And we're going to be looking at kids from SC, ST, OBC, and general caste. And while we'll talk about all 3 of these, sort of the main focus of the paper was understanding the SC general gap. Okay, so I won't get too much into the methods. I'll just mention that what we do, sort of our main methodology, is to use a reweighting decomposition to try to understand how much of the gaps between general caste kids and kids from these 3 disadvantaged groups can be explained by differences in standard SES variables. And so a reweighting decomposition has to use a limited number of predictors or bins. And so we played around with a lot of different types of variables and went with floor type and mother's education level as what we wanted to use to capture socioeconomic differences across families. And so we have a reweighting decomposition that uses the intersection of the 4 floor types and the 6 education categories for a combination of 24 bins that we're doing our reweighting over. And so this figure shows the decomposition results. So if we think about the fold difference here, this is the same gap that I was showing you before, but this time with a confidence interval on it. So it's right here around 0.45 for both ST and SC kids. And for OBC kids, it's over here at about 0.3. And so then when we account for the fact that kids from these different backgrounds have different mother's education and floor types, so basically different socioeconomic status, we find that those differences explain the entire height gap between ST children and general caste children. So a lot of the forces that are behind this height gap for STs are about socioeconomic differences. but it doesn't explain the whole thing for SCs and for OBCs. And so that got us to be thinking about, okay, what other variables could we include in this model that would help us explain the rest of the gap? And this is where we started exploring the literature on segregation and social rank, and trying to think about whether neighborhood composition and local social rank could explain the rest of these gaps. And so we needed to come up with a way of measuring the distribution of caste groups into neighborhoods to think about segregation. So we ended up coming up with a pretty simple variable. So this is the cumulative distribution of the fraction of households in a child's PSU. You can think of a PSU as a neighborhood. It's a primary sampling unit. It's a term from survey methodology, but it's the cumulative distribution of the fraction of households in a child's neighborhood that have a higher caste rank than her own. So if you're SC, that would be the fraction of households in your neighborhood who are OBC or general. If you're OBC, it would be the fraction that are general. And so we see that, for SCs, there's a pretty, wide distribution of this. Some SC kids, they live in neighborhoods where 20% of the households outrank theirs in the caste sense, and some live in neighborhoods where 80% do. And it's, obviously a little bit less for SCs because for OBCs, because they would outrank SCs. And so this variable of local caste rank is one that we're going to now include in our analysis and try to see whether, if we also include neighborhood segregation, can this explain the gaps. And so I didn't want to put the regression results and sort of bore you with that. If anybody wants to see them, I have them at the end, but I'll give you our sort of main figure that came out of that. And so what this does is plot net of the socioeconomic status variables that we did earlier, the average height for age of kids, so residuals after those SES bins, against the fraction higher ranking. And what this is intended to show you is that, where did that pointer go? That where the SC and OBC kids are outranked by other households in their neighborhood, they are shorter on average, but when we look at kids who live in PSUs where they're not locally outranked, their heights sort of match what we would predict based on their socioeconomic status. So this is showing neighborhood segregation playing a role, and a different role than we see in other countries. So, we could only take these data so far. We did a lot of thinking about what the possible mechanisms could be. Why would it be that living in a neighborhood where you're surrounded by other SCs is actually correlated with better child height outcomes, when usually we think of services being better if you live with high caste people or something like that. And so we have thought a lot about what sort of stress might result from the discrimination and violence that come with untouchability practices. We think it's plausible that those affect pregnant women and the growth of children, although unfortunately the DHS don't allow us to test that in the data. Hopefully, much as these sorts of data are becoming more available with biomarkers in rich countries, we might soon start to see that sort of data being collected in India. Then we sort of came to an explanation which our group is much more familiar with, this idea that open defecation might be playing a differential role depending on the type of neighborhood that SC kids are living in. So one of the surveys that I'll be talking about in a little bit had sort of a side question that we sort of wished we'd pay more attention to afterwards, where we found that SC respondents in this survey were more likely to say that they see people defecating near their houses than general caste respondents. And so the idea there would be that perhaps the same level of open defecation is more highly associated with height for SC children when they're living around people who are basically going to come and defecate near their houses. And perhaps if you had sort of a uniformly SC neighborhood, there wouldn't be this sense that it's okay to sort of poop near people's houses. Everybody would go further away. Indeed, the sort of opening text of the Valmiki book that I put up in the beginning talks about how upper caste people would come and defecate near their houses. And so, we don't have really solid evidence for this as a mechanism. It was sort of in the discussion section of the paper, but somebody who were interested in this could do a more detailed mapping of what the village composition has to do with defecation patterns. And I think that would be sort of the next way to take this research forward. Okay, so just to summarize this
question.
Paper. Sure, jump in.
Could you give me a sense of what the size of a PSU is in terms of like kilometers or like just the area?
Yeah, so in a village with less than 2,000, it would be the whole village. And if it's more than 2,000, then the DHS would have segmented it. And so they would have, if it were more than 2,000, say it were like 2,500, they would have broken it in half and mapped only half of it. And so then it would be smaller.
So could a plausible reason be the crowding out of resources by the upper caste? They just take away all the resources and not much.
That would actually go the other way. And that's what's sort of so curious about this, because we find that SC children who live in neighborhoods with higher caste families are shorter. And so like if the upper caste people were sort of attracting health centers or a better PDS system, then, oh, you're saying, but they're there. And then, yes, no, that's certainly plausible. And it would be sort of worth looking at that more, whether like if you have an entirely SC hamlet, the government still provides something, but then SC children get it. Yeah, definitely.
I also had a similar question because I was thinking of how this finding relates to Dean Spear's finding of improved outcomes for Muslim children in urban India and the role of the sanitation channel over there.
Yeah, so that paper was a little bit different in that it was looking at differences between Hindu children and Muslim children, and it found the neighborhood externalities were really what mattered. So if you had a lot of Muslim neighbors, you were going to be taller rather than if you had Hindu neighbors, because Muslims were less likely to defecate in the open. Here, we think that there's something more about like not the level of open defecation, but if you have a mixed village, where do people go and defecate? Does that help explain sort of the difference?
Yep, got it. Thanks.
Okay, so just to sort of summarize or highlight the findings here, we have a similarly sized SC/ST general caste gap in child height, but we think that they're reflecting different mechanisms, largely SES for the ST gap, and then SES and local social rank for the SC and OBC gaps. Okay, so what we take away from this is like we have this. There's a context of sort of national social inequality in India where the government is trying to respond with things like reservations in political posts, but those sorts of things only go so far in getting to sort of the very local day-to-day social inequality, such that we think that this local day-to-day social inequality is so important, in fact, that like in this case, segregation may actually be better, which is sort of counterintuitive compared to some other contexts. So, we can maybe talk more about these findings towards the end. So now let me turn to sort of a core argument in our book, where we're going to be looking at how caste and untouchability actually work in ways to make the entire population shorter, not just SC, OBC, and ST kids. So here I just want to recognize my amazing collaborators, the whole team. I won't list everybody out, but kind of amazingly, since we got this started in like 2013, so many of these folks are still finding different ways to work together and continue to collaborate, and that's really been exciting. Okay, and so we've been talking a little bit about open defecation, but if you didn't already know what it was, it's going to be sort of essential to this part of the talk. So I'll just mention it's when people defecate outside without a toilet or latrine. And a lot of the research that group has been doing shows that open defecation combined with population density in India is a really important threat to child height and therefore human capital development. And so this is sort of an old graph now, but these three large circles are India, and it shows that So these are observations are countries in the demographic and health surveys, countries in different years. And there's a strong negative correlation between the average height per age of children and the people who defecate in the open per square kilometer. And so India has a lot of people defecating in the open in a small space, and consequently much shorter children than might otherwise be the case. And so that graph was a bit old. The last data in it were maybe from 2005. So this is from an EPW article that updated the open defecation figures based on the NFHS. And we see that although open defecation has declined in India, it is still really exceptionally high in an international and South Asian context. So here were the 2014 figures. Rural India was still more than half of households were defecating in the open, and what we refer to as the SWAT states are Bihar, MP, Rajasthan, and UP. It was sort of even higher there, and we see much lower open defecation in Pakistan, Nepal, and Bangladesh. So this is from the survey was done in 2018. The paper took a while to come out in EPW in 2020, but this is from a survey that group that you saw did. It's a panel study, so we visited the households in 2014 and then revisited them towards in 2018 as the SBM, the Swacch Bharat Mission, this major government latrine building program was wrapping up, and we measured the change in open defecation in these places. And so we did see big changes in open defecation across these 4 states. Now, keep in mind that this was at the end of a really coercive and enormous program, and we don't know the extent to which these large changes have been maintained. But one thing that's sort of sad and interesting about this is that despite the fact that we did measure big changes, the government was claiming complete 100% reduction in open defecation down to 0, and that was clearly not the case. There were still large fractions of people across these states defecating in the open, as many as 60% in Bihar and more than half in Rajasthan. So this was, it would have been better had this campaign been able to reduce open defecation by more, although that's not to say that it did nothing. But I think that the sorts of things that I'm going to be saying about open defecation being widespread, it being linked to caste and untouchability, and that being pretty bad for population health in general, despite the Swacch Bharat Mission, those things haven't changed. So, this argument remains unfortunately true today. So let me talk a little bit about why there's so much open defecation in rural India, why we see it being so much higher than other places. So one big factor is that people are unwilling to use the sorts of inexpensive pit latrines that the government was giving out. And people who have these types of latrines want to use them only a little bit or not at all. And so I want to show you a few pictures that our team took in different places around the world, just to give you a sense of how different people around the world think about latrines and latrine use. So this was a latrine that was constructed in Kenya by a family. They did it themselves. They didn't want to defecate in the open. And so they came up with this makeshift latrine that, is basically a hole dug in the ground with some privacy shades. And it's helpful for containing their feces and keeping their kids healthy, because it means that flies don't go from feces to food and that sort of thing. So despite the fact that it's inexpensive and makeshift, it's good for health. Similarly, this latrine from Bangladesh was a little bit more fancy than the Kenya one, but not particularly expensive or fancy. And yet this family is keeping their kids safe by using it. In contrast, here's a latrine from Haryana. This family defecated in the open until they were able to spend about 60,000 rupees building this latrine bathroom combination. And although the fact that you're seeing sort of the water tank and the cement, all of that's expensive, the thing that was actually really expensive about this latrine was the underground pit. So in comparison to sort of average pit size in other countries, latrines that are used in rural India have these really enormous underground pits. Here's one of my collaborators who decided to jump into the pit for the purpose of showing you just how large it is. Here's another one being built in UP. And so these are sort of out of the price range of many poor families, and they certainly don't fit into the 10 or 12,000 rupees that was being given out by the SVM. Families would have to invest a lot more in their latrines in order to get something that they were really interested in using. So that sort of raises the question, why are rural Indians not interested in using these inexpensive latrines that help improve child height? So the WHO estimates that the sort of pits that the government was giving out and the ones that they recommend, it's about 50 cubic feet in size, and they'll last a family for about 5 years. After that, the family either needs to construct a new pit or empty it manually. And so when we think about how this sort of interacts with the social structure in India, we need to remember that rural India has untouchability still, and to a certain extent, still some manual scavenging, and a really important history of manual scavenging being part of sort of the day-to-day social lives and the way that upper caste people and lower caste people interacted with each other. And so the fact that untouchability still matters, that these social forces are changing, and that manual scavenging is sort of still at the top of people's minds, make these latrines that the WHO and the government were recommending something that's not really acceptable to people. And we're going to be talking a little bit more about that. But before we do that, maybe I'll just sort of flesh out what is manual scavenging, like why does it matter? So it's the manual removal of feces, and it's done by a subgroup of untouchable castes. And here's a picture of like a few different ways that manual scavenging could happen. So, a person could go to somebody's house and like clean out a hole near where they defecate. This woman actually went into a dry latrine and is cleaning it out. And here's somebody emptying fresh sludge from a latrine pit. So all of these things are considered manual scavenging. And the sort of manual latrine pit emptying that is done in many other countries is associated in people's minds with this act of manual scavenging and with the untouchability and social exclusion that go with it. And so part of the work that was done for the book was to go around and talk with people about what pit emptying would mean to them if they were to either hire somebody to do it or try to do it themselves. Would that be possible? Are they interested in the sorts of latrines that the government was encouraging people to build? So this is a quote from an OBC woman in Sitapur district in Uttar Pradesh who was talking about how pit emptying, subjectively, she just couldn't imagine doing this. She explained sort of the social implications of pit emptying for her and her family. She says, we could not empty the latrine pit ourselves. They have to call somebody from a particular caste when something gets clogged in the latrine. How could we open it ourselves? It's disgusting. So a person from that caste must come to clean it. She explains, we are Hindus, so how could we clean it? As if, she wants the researcher to sort of understand all of these social implications. She says, how could we worship afterwards? If money were an issue, we'd have to take a loan. We would have to find some way to get it emptied. This work can only be done by people who inherit this occupation. They belong to this caste and have been created for this work. So it's much more than just like, this is a disgusting job. It sort of has to do with your entire social identity, with sort of your position within the social hierarchy. So definitely these latrine pits just mean something more in a society that has untouchability. And so that's sort of the upper caste view on these latrine pits. But we also talked with people from castes that traditionally did manual scavenging and tried to understand, how does the sort of modern recommendation of a latrine fit in with what they want for themselves in their lives. And so, as there are more latrines being built, as people are maybe less interested in defecating in the open, there is an increase in the amount that people are willing to pay for pits to be emptied. And yet the supply and the demand are not meeting each other. And so this is actually an NGO worker who worked closely with people from pit emptying caste, trying to recruit them to empty the latrines that this NGO was building. And he said, I simply couldn't do it for people who empty or for people from those castes. They think, okay, I might be able to earn some money, but it's going to entail so much social discrimination that I can't go to restaurants, I can't go to a temple. So what's the use of having money if I have to suffer this social discrimination? And in other countries, although manual pit emptying is unpleasant, it doesn't carry the same level of social discrimination and stigma. And so sort of along these lines, here's a quote from a conversation with a Dalit man in UP whose parents did manual scavenging type work, but he doesn't do it himself. And he talks about how social progress for Dalits is part of this story and part of people saying like, look, you know, we're just not going to deal with inexpensive pit latrines. So he says, I've seen Dalits clean up and eat scraps at weddings. Ever since I became an adult, we have not done that sort of work. I'll tell you, I certainly won't eat the food that's left over on anybody else's plate. And so this was part of a conversation about how there has been some social progress for lower castes in villages, and they feel like now they can say no to doing that sort of work and see that as an escape from the social stigma and the social discrimination. So we see rural people, both high caste and from scheduled castes, associating pit emptying with manual scavenging and just saying like, hey, we're not going to do it and we're not going to do it. And so if nobody's going to be emptying these latrine pits, like what was the SBM doing? Why did they construct so many latrines that people associate with manual scavenging? Well, their claim is that, you know, they weren't encouraging manual scavenging. They would say this has been illegal since 2013, although, you know, folks at Safai Karmachari Andolan and other organizations would point out that actually no cases have been prosecuted. So how serious was that ban? But to go back to the government story, on paper, the idea was supposed to be to build 2 pit latrines and to allow the feces to decompose in the first pit before emptying it. And it is actually safe for health and not covered under the Manual Scavenging Act to either yourself or hire somebody to empty a decomposed latrine pit. And so this was the idea that like we should let one pit decompose, it becomes healthy, you know, not a threat to health, and then it can be used as fertilizer. But I would argue that this was just like too far beyond what people had in mind. There wasn't enough education around this, and just really too far from what we could expect given the sort of social relationships in villages. And so in practice, because there was so much resistance to the type of latrines that people were that the government was pushing under SBM, we saw the government use just really a lot of coercion in order to force people to build latrines on their land with very little regard for teaching people how latrine pits would work or addressing concerns about pit emptying. And so, you know, I expect that this was actually a latrine that was built under the prior latrine building program, Nirmal Bharat Abhiyan, NBA. But I expect that many SBM latrines are going to look like this in a couple of years. And so if I can just sort of take a minute to wrap up, the argument then becomes, okay, you know, we have open defecation being what a lot of people do because they can't afford to build these enormous latrine pits that cost a lot of money and are a major investment. And they're not willing to use the sort of simple technology that is containing feces in other parts of the world. And so what we end up with is widespread open defecation, you know, and the failure to adopt simple pit latrines is related to untouchability. And so this is sort of how the continuing practice of untouchability and this history of manual scavenging leads to widespread open defecation. And once these feces are in the environment, they don't discriminate between SCs and general caste kids. Everybody is going to end up shorter than they would be if everybody in the neighborhood were using latrines. Okay, so that is the end of what I have to say. I'm happy to take questions. Yeah.
Thanks a lot, Dan. I've asked everyone to post their questions in the chat. I think it's also possible to just unmute themselves and they can ask their questions. But maybe to get us started, I can ask a question that was posted in the chat already from Sophie. It was about, has there been testing for parasites transmitted through fecal oral routes that may account for stunted growth?
Yes, definitely. So the link between open defecation and parasite infection is really well established. There was a lot of work done in the 1920s, funded through the Rockefeller Foundation in the American South, showing that open defecation in the American South was leading to parasite infection and was causing anemia and stunting and other health problems in kids. There's been some more recent work about parasite infection in East Africa that you may be familiar with JPAL, but this is like super well established. When we got into this, sort of the more up and coming understanding of how fecal contamination influenced height was through like a mechanism where the continuous exposure to disease was actually like changing the lining of the intestine and making it harder for kids to absorb nutrients. And that is research that's been developing and sort of improving since we got started on this.
Arushi, yeah. Diane, thank you for this meticulously executed research on a difficult subject. I have a couple of questions. One, from the history of the West or East Asia, let's say, what do we know about when open defecation ended? We can talk about, let's just talk about America. And if you can talk, if you have a good empirical knowledge of Europe, by all means, talk about that. But East Asia, I remember many years ago as a graduate student when I went to a class by Ezra Vogel, who used to be a leading Japan scholar, and took his to his lectures. He would start describing Japan or what has happened to Japan or transformation in Japan by first saying that when he started research in Japan in the early 1950s, beyond some neighborhoods or very posh neighborhoods of Tokyo and Osaka, open defecation was quite common, actually. And so what do we know about it? Just some comparative data on when open defecation ended in the higher income countries, right? That's the first question. Second, can you lay out a little bit more? I think I understand the intuition here. Can you lay out a little bit more the link between the practice of OD and its effect also on the heights of upper caste children? Right, can you lay that out for me? That's all I have. I'm sure other people have other questions, and if I have some more, I'll come back.
Sure, great. So maybe I'll start with the second one. So let's imagine that. So the question is, like, why is it the case that open defecation hurts upper caste children? So kids in villages will sort of run around, they'll play in the fields, flies move around. And so pretty much anyone leaving their feces in the environment, whether they're upper caste or lower caste, that's a threat to all of the kids because the flies might go to an upper caste person's house, they might go to a lower caste person's house. Similarly, like when kids are running around in the fields, if they encounter feces, they get them on their feet, they get them on their hands. It doesn't matter whether upper caste or lower caste. If there are feces around, that's going to be a bad thing for you. With the first paper that we looked at, we wondered if it was a little bit worse for SC kids in places where it was like socially acceptable for people who defecate in the open to do it like right next to the SC houses. with the idea being that like, certainly we're not going to do it as close to the general caste houses. We might get yelled at or we might suffer social sanctions. So it's definitely going to be bad for everybody. It would be worse for the people whose houses it happened closer to. Does that make sense?
Yeah.
Okay, cool. And then I am sort of embarrassingly unfamiliar with East Asia. And so I won't have much to say about that. In terms of in the US, you know, as I was mentioning, there was kind of a lot of open defecation through the 20s and 30s in the South. And one thing that's been sort of good about this, being involved in this research, is that I do get contacted by folks who study different places all over the world. And even, you know, as recently as last year, I was being contacted by a postdoc who was working on the fact that in some rural communities in Texas, people are so poor that they're not fixing their septic tanks that are in their yards. And so these are leaking and leaching, and she's been studying parasite infections in these communities. And so I would say that unfortunately, this appears to still be a modern problem in the US. It's a little different in that people aren't defecating in the open, but if there aren't city services, if people are sort of left to manage their on-site sanitation on their own, that actually has these same sorts of negative externalities, not to the same extent, but negative externalities for anybody who lives in that area.
But open defecation as a mass practice ended around, what do we know about, and when did it end in American South? No.
I don't think it was even a mass practice then. I think like in so much of the world, people have really built and used latrines for a long time. And a latrine could be something as simple as a hole in the ground. So I think it's been a while. Basically, since there was like the understanding of germ theory of disease and that sort of stuff. I think a good book for this would be maybe the fatal years or the early years. I'm thinking of Sam Preston writing about sort of the germ theory of disease coming into American cities. And so, yeah, I'm sorry, I'm not better familiar with it.
Can I please ask a question?
Yes.
Hello.
Sure. Yeah.
Yes, my name is Sanjeev Kumar. I'm calling from New Haven. So I was wondering to what extent poor health itself could be a reason for continued practice of open defecation. So I'm looking at the functioning of olfactory system, and it seems like, you know, if you are nutritionally deficient, then your olfactory system would not work very well, and your ability to assess the hygiene of your environment will be compromised. So I grew up doing open defecation. I come from a village in Bihar, and I'm like, you know, six foot tall, and same in my village. So the idea is like, you know, are we putting the cart before the horse, in a sense that rather than focusing on how to help people, obviously open defecation is a big problem, but the kind of shame, the way it has insulted people's self-respect and all, for no fault of theirs, because in my village, like, you know, we had a rule that we'll follow when it comes to open defecation. In 1930s, when they went to India to understand, like, you know, why India was not using a lot of fertilizer, one of the reasons was a practice of open defecation was a recycling method, and that was fertilizing the land in the villages. So I have a very difficult time understanding the narrative that you have built. I love your work; it's very rigorous, you know, but I feel maybe we are missing something here, and that is poor health itself is a reason for continued practices of open defecation. What do you have to say for that, on this perspective?
Well, thank you for that question. I think it reminded me of something from my own childhood. So I grew up in rural Connecticut, and we had a septic tank, and we also had a coal stove. My parents had this weird idea that they wanted to be free from the sort of price fluctuations of foreign oil. And so they retrofitted our house to have coal in it. And so I grew up breathing coal dust. And I later learned that this was, not very good for my health and probably not a good idea on my parents' part. And it made me wonder how much taller I could have been had I not had this. And so I don't think it makes any of us it's not an insult to any of us to say that we ended up growing up in a social environment that wasn't good for us and probably had lifelong effects on us. And when we think about the sort of social rules that govern open defecation, I've been talking about sort of how caste and untouchability play into pit latrine adoption. They were also hugely at play in the government's efforts to get people to build latrines, particularly in the 4 states that we studied, Bihar, UP, MP, and Rajasthan. And one thing that was just really tough and sad about what we would see would be sort of upper caste village leaders who could afford to build the sorts of latrines that were socially acceptable, shaming Dalits in their villages into accepting latrines that everybody thought was socially unacceptable, and then sort of going around in committees in the morning and blowing whistles at people who were defecating in the open, often Dalits. And sometimes those same upper caste sarpanchas or pradhans who were leading sort of this assault on the low caste people in their village would let the women in their households use the latrines and go and defecate in the open themselves. And so I think just caste comes into every social interaction almost in a village, and it's hard
So Diane, I grew up in that environment. I don't remember ever anyone saying that go and defecate near lower caste people's houses. It's just that narrative is because it's my personal experience, until almost my high school, and everyone almost in my village, they have latrine now because they are richer, they are healthier, they can understand what kind of negative impact it can have on your health. So the point is rather than informing this, bringing this foregrounding this social narrative, I feel can damage India. That's not obviously your intention. But I'm just saying that far deeper rituals were in place, when open defecation was going on, then just people not having a good sense of hygiene. India was one of the cleanest places until 17th, 18th century in the world. You just look at all different paintings and other, it's mind-blowingly clean. It just people are in such a poor health now that their ability to assess the hygiene of the environment is compromised.
So maybe I'll jump in and answer Mansi's question from the chat.
Oh, sorry for that. Yeah, go ahead.
Okay. Or maybe Arushi, do you want to read it?
Oh, yeah, sorry. Yeah, I'll just read it out. So Mansi says, although the government of India has come up with policy providing toilets to the people, but still people from below poverty line are not getting this due to many factors like casteism. So what should be the possible efforts we should take to counter this problem?
Yeah, I wish I had a better answer. And I think I saw it, maybe he's had to go to class, but my colleague Nazar was also here briefly. He worked on the later survey, the second round of the panel, and that did a lot of work on sort of what were the local interactions around SBM. So I feel like he would have a better answer, but I think he stepped out. Gee, it feels like $1 million question, like how can central government policies escape the sort of ways that casteism redistributes resources in villages? I wish I knew. Maybe Ashutosh, do you have any thoughts on that?
Although the government of India has come up with policy providing toilets to the people, but still all people below poverty line not getting due to many factors, example, casteism. So what should be the possible efforts we should look to counter that problem? Yeah, I think it's a very important question, but very difficult one.
I mean, the place that we're at right now is that, you know, the official line is that there's no more open defecation in rural India. So,
yeah,
I mean, we
I
just
was
feel so
working
far
in
from being able to say, how do we get?
Right.
Yeah.
I was working in Lucknow until last January when it became impossible to, because of COVID, to go back. And Lucknow has a status in Government of India of ODF plus, I think.
Exactly.
And we were working in a scheduled caste neighborhood where half of the people were still going to the railway tracks. So the Lucknow status, according to Government of India, was ODF plus, but there was a lot of, and this is we're talking about state capital here. We're not talking about the countryside. So yeah, you're right that according to Government of India, ODF doesn't exist anymore in much of India, but that ODF has come down significantly. I think is beyond doubt. You were absolutely right. But it might also help to answer this question. I think this very important question that has been posed by Mansi Bhagat. I think it may make sense to do a comparative exercise and see how the problem was conquered in a place like Kerala, or to some extent Tamil Nadu. I think to a substantial extent Tamil Nadu, but Kerala, let's say. I think Kerala is ODF free, literally ODF free. And when did it happen, and how people were persuaded? I mean, not OD. I mean, Kerala is OD free, not ODF free. OD free. So I think some comparative analysis might help us answer that question. But it's a very important question. I don't know the answer.
Kanupriya has an intervention to make that might be relevant to this discussion. She is saying that political leadership is mostly upper caste, so any such efforts definitely need to be more inclusive and should be an endeavor in participative politics and governance. So I don't know, Diane.
On primary education. On making the illiterate literate, I think there is enough data on that. If it travels to, I don't know whether Diane would agree that the problem is roughly the same. I don't know whether it's the same, but we should ask her. Myron Wiener has a famous book on how primary education spread in places like Kerala and Tamil Nadu, and did not in much of northern India. And the answer was again and again that lower castes rose in power in South India much earlier than in North India. And once they came to power, including the Dalits, the attack on caste-related exclusion in primary education became so much more serious and so much more effective. So the question that is being asked here about inclusive participation or inclusive politics, certainly Myron Wiener's book in the 1990s became a classic on primary education, does suggest that is how South India was changed. I don't know whether it travels to sanitation, but on primary education, that was certainly an argument, a very important argument in the field.
The idea being like social movements to eradicate discrimination against low castes.
So social movements and restructured politics, and these people entered politics, entered positions of power, and the idea of, first of all, the very idea that, for example, the number of education secretaries in North India, including a famous one that he didn't cite personally, one of the most famous education secretaries from North India, who became an education secretary in Delhi. He argued basically that if we educated everyone, who would clean the toilets and who would clean the streets?
You might just have to pay them more.
No, so I mean, I'm telling you that, yeah. So that's the economist, a typical economist answer. But this relates to the question here about lower caste entering citadels of power, first through social movements, then through actual formal power, and then changing practices down at the ground. Now, I don't know. What I'm saying is that it should what happened in primary education should also be true by extension, and maybe more true for sanitation, because of this horrible stigma of manual scavenging.
Yeah, I mean, I think it's not inevitable that like people in North India will defecate in the open forever. I think the real issue is that people are just going to want to skip over this phase of simple pit latrines that have helped kind of every other poor country escape open defecation. And so if sort of poor people had enough money to buy the sorts of latrines that rich people in North India have, I think they would have them. I don't think they're opposed to having sort of latrines that can be emptied by a truck. And when we talked with people who had truck services in South India, they said that they basically didn't interact with the sorts of latrines that the government was promoting, that people basically had sort of more expensive latrine pits that could be, so they get like sucked out by a truck and then they go to a sewage facility. So I think it's this interaction of like, you know, you need a lot of money for an expensive latrine and you don't want the cheaper alternative because of the associations with untouchability.
Right.
And certainly there's, yeah, go ahead.
It also seems you're suggesting a threefold distinction in the evolution of sanitation. One is open defecation. Second is pit latrines, and third would be modern toilets, flush toilets, right? It seems like, so on modern toilets, the question that I was asking about Western Europe and America, on modern toilets, I had a couple of presentations in a seminar long ago, and the city of London got, I mean, modern toilets cannot come without provision of water for everyone, piped water for everyone. Easily that can't happen. So that happened in London only in 1903, 1904, 1905. That happened in Paris in 1930, 31. Otherwise, in the morning, from China, those who worked in China in 1980s until 1990s, actually, they talk about modern sanitation systems not reaching even Shanghai and Beijing, let alone smaller towns. And the transformation took place only in the first decade of the 21st century. But anyway, that's a modern sanitation issue, modern toilets issue, flush toilets issue. That is not what you're dealing with, the transition from open defecation to pit latrines, right?
Right. Yeah.
So that's a threefold classification here, which is. Right.
Diane, I was also wondering about this recent paper by Swana O about occupations and caste, and she basically ran an experiment where even when she offers a higher amount of money to upper caste people to do jobs that are typically considered to be performed by Dalits, they were not willing to take even that higher amount of money. So I was wondering how that would also sort of fit into your narrative.
Yeah, no, this is making really the same point that we were making with that qualitative research, that we have a situation where higher caste people, you know, are not going to empty their own pits. They're certainly not going to go out and empty other people's pits. And even though the prices are increasing for people to do pit emptying work, the vast majority of Dalits, due to some economic and social progress, are able to refuse it in a way that they weren't when it was more acceptable to just sort of have somebody as, you know, a forced laborer on your land.
Right.
And in your house.
Could it be that if you were a Dalit living in a more unsegregated neighborhood, then you might be forced into those jobs? Is the likelihood higher? Do we know anything about that? Because I'm just trying to think of how this relates to the segregation story.
Yeah, so I don't have an exact answer to that, although I did a book chapter kind of recently where we looked at the NFHS data on people who reported using manual scavengers. And it's actually, I mean, it's not very high, but it's much higher than the government reports of how many manual scavengers the government thinks are out there. So it's not that this is gone, and I bet it is more common in like heterogeneous caste neighborhoods.
Okay. Thank you. Are there any other questions?
Yeah. Diane, can you also lay out, sorry, is there somebody else? I've been speaking to.
No, please go ahead.
I think this work is so important and these questions have to be asked. Can you lay out the mechanism again between your very remarkable conclusion that segregated Dalit neighborhoods have healthier Dalit children?
Yeah, so I wish we could like really have some data that would sort of nail it and hit a home run on it, and we don't. So what we have is a large literature from other contexts about, and particularly actually from the US racism literature, where we think about sort of the poor neonatal outcomes amongst Black moms in the US being related to sort of the chronic stress of discrimination. And so that type of research suggests that some of these neonatal mortality disparities in the US could be because of the stress that pregnant Black moms experience. And we think that a very similar thing could be going on if Dalit women who are pregnant are sort of day-to-day living the stress and discrimination of having upper caste neighbors. We have no data about it, and I would love for sort of somebody to get involved in that. That seems plausible. And then the other thing that I was talking about on the open defecation side is the idea. So this idea came about for two reasons. One, in like this very poignant opening scene in Valmiki's book, he talks about how the upper caste in the village in UP where he grew up would come and poop by the lower caste people's houses. And so, you know, we had that very poignant story. And then it led us to sort of toss this question onto our sanitation behavior survey. Hey, have you seen anybody, do you see people defecating near your house? And then we also had some questions on like, okay, what do you do? Do you like socially punish them or say anything to them about it? And lower caste people were more likely to say that they saw people defecating near their houses than upper caste people. But unfortunately in that survey, we didn't have anything about the heterogeneity or homogeneity of the village. That was something that we could get from the NFHS data. And so what we do see in the NFHS data is if you regress child height on being SC, the effect, okay. So you regress child height on open defecation and the interaction of open defecation and being SC, the same level of open defecation in a village is more associated with poor child height for SC children. And so that's sort of where this argument is coming from, but it's not the case that we have like all of these pieces that we can put together in one empirical analysis.
I see.
So it's a hypothesis and it would be great for somebody to test it.
Yeah.
There's one question from Katyayani, Diane, about your work on public health in rural UP. She's wondering if you could share your thoughts on the ways in which the current COVID crisis is a continuation of and a departure from sort of pre-COVID times, and particularly if you could say something about the role of the state. Katyayani, if you would like to ask your extend your question, and if I've missed something, please feel free.
Hi, Dan.
Hi, it's so good to see you. I haven't seen you in forever.
It's really nice to see you too. Yeah. And about how the work is progressing. Congratulations.
Thanks.
Just trying to get your perspective. You have spent a lot of time in district hospitals, community health centers, primary health centers, and what do you think of what is happening? How is it? One hypothesis that I've heard is that the current situation is not very different from what already was happening and being experienced by poor people and rural people in UP. It's just that now middle class and upper class people are experiencing the same. Just thought to ask you how you're thinking of the current situation.
Yeah, no, I think it's on my mind a lot. So I think you're referring to this idea that some people have been talking about, that like, you know, now rich and middle class Indians are facing a situation where they have an urgent health problem, they need medical attention, and they just get shuffled from hospital to hospital and sort of end up dying outside of hospitals or on the way. And that it is so difficult and painful to think about that. And yet this is actually an enormous problem in maternal health in UP and Bihar and some of the other northern states. So people who have poor women who have a complicated delivery may start off by going to their CHC and simply get told that they're not going to be treated there. They could get sort of unlucky enough to be recommended to an unqualified predatory private provider who maybe does an unnecessary C-section, probably doesn't have blood, or they could end up following the same pattern that we now see sort of wealthier COVID patients, where like they go to different hospitals, and if it's really an emergency case, they're just going to be turned away. And so we don't even have good data on maternal deaths about where they happen because nobody's reporting them. And they very often aren't happening in facilities because no facility has the incentive to actually take them and treat them. And so this very failure that rich people are now experiencing has just, it's been the nightmare in maternal health kind of ever since there was an effort to get women to deliver in facilities. Yeah, thanks for asking that. It's tough.
But isn't the COVID suffering? It has a cross-caste character. It's a cross-religious, cross-caste character. It's hitting only the very richest can save themselves if they fall sick, right?
Maybe not even them.
Not even them. So it's a question of, this is a case of mass suffering of a kind that even famines don't generate, right? Famines also they only hit the poor and the middle strata. They don't hit the upper strata. This is a problem that goes beyond the Bengal famine. The description of Bengal famine in Amartya Sen's book, it shows you how those who were landed, the landed classes in Bengal countryside could save themselves. Even sharecroppers could save themselves. But the landless and those in the informal sector died by the million. It was 3.1 million deaths in 1943. Luckily, we are unlikely to cross that, luckily. And if we do cross that, we certainly will not, India will not cross the 1918 figures, which are of the Spanish flu. But this is a cross-caste phenomenon, right? It's only
definitely
the cross-class phenomenon. And it's of a different, the problem is of a different nature. I don't know what Kalyani thinks about what I've said. Not Kalyani, sorry, Katyani. Yeah.
Yeah, it's affecting everyone. Part of the reason I wanted to get Diane's perspective on this is to understand how much was this a problem that's already been happening but affecting fewer people. Every year from UP, you will, so before COVID, every year from UP, you would hear of children dying in public hospitals in massive numbers because of the shortage of medical oxygen in ICUs or ventilators. So yes, is COVID only different because it's affecting more people? The state failure that is showing right now, or is there something about the virus itself that is affecting the failure of the public health system to cater to the needs of the population? I mean, my research again is just starting on this question, so that's why I wanted to hear Diane's thoughts about maternal mortality, and by bringing up maternal mortality, she's again made me think about what is specific about COVID that's different from maternal mortality. How is an infectious disease different from an injury or a road accidents, in which the situation in UP is bad just because it's affecting more people, or has the system itself failed in a different way than it was already failing?
Yeah, and I guess my thought was just that, like, I see a lot of overlaps in the way that it was failing poor people. Now with this greater stress, it's failing everybody. That's one way to see it. Although of course it's a different disease and, you know, different scale and affecting different types of people.
Are there other questions in the audience? Yes, in that case, we can end on that note. Thank you so much, Diane, for a great talk, for a very enlightening talk on a very important topic. I'm glad we were also able to talk about and discuss the current crisis, which has impacted so many of us personally also. But yeah, thank you, and we look forward to hearing more from you and reading your work. Thank you.
Thank you so much for having me. It was nice to see you.
Diane, thank you on behalf of the center, center director. I would especially like to express my gratitude for your talk, and we look forward to further iterations of the work. Yeah.
Okay. Take care,
Thank
everybody.
you very much.